so much for the insightful presentation, Dr. Sampoornam.
Thank you, Gazelle.
And I must say the question was very interesting. And yeah, you know what? One of our attendee earlier said that they wish they could just get to know that a person is having what kind of disease a person is having at the time, or a person can have in future.
Yeah. Would you like to know that whether we can predict it or not?
Yes, definitely.
Yeah. See, I'll tell you, who has this question? I would like to know.
I guess it was Miss Fatima.
Yeah, that's good. That's good. See, as you asked, the thing is, there is one component in health checkup. There is one component called mental health checkup. We all do not know what is mental health checkup basically. So in Indian setup, we don't go for mental health checkup. In foreign countries, along with general health checkup, there is a component called mental health checkup. They go for thorough mental health checkup and they find whether they can develop depression, or they really can go for any anxiety, or they're really stressed or not. So we do have standardized tools for that, tools. Based on the tools and scores, we can predict how far they are. Really, mild or moderate, severe, we can just state all those areas.
That's great.
Yes.
Miss Fatima.
Hey, hi.
Hi. Was the question from you, if I'm not wrong?
Yes, it was for me. Thank you for answering.
Anything else you would like to discuss with Dr. Sampoornam?
Yes, I have one more question about the aversion therapy. You said at the beginning, you said that it's used for homosexuality. I just want to know, how do they use it in that way?
No, what therapy you're talking about? You're talking about
Aversion
aversion therapy?
Yes.
Yeah. See, for homosexuality, it's just a book picture. At present, we follow for alcoholic clients and addiction clients, and basically for suicidal thoughts, repeated thoughts, obsession thoughts, clients and all, we use aversion therapy. For homosexual clients, it's very rare. We don't see, homosexual is normal. First, you should know that. Madam, you should know that homosexual is normal nowadays. Not nowadays,
yeah.
even from the past, I'll tell you, homosexual can be divided into two: ego dystonic and ego syntonic. See, ego dystonic client will have subjective distress. Or I'm practicing homosex, literally I'm under stress. For that clients alone, we go for counseling. Even those who are with ego syntonic, we don't go for counseling anything. We just make them to be happy with that homosex. Ego syntonic clients will not have any subjective distress. They'll be very happy or very much satisfied with that homosex. So we just encourage, we don't bother much about it. We don't go for counseling at all for them. So homosex, it is not a disorder. First of all, you should understand the same.
So they used to use this aversion therapy before they thought it's normal.
Yeah, some long back they would have used it. Present, it's not the scenario.
Okay, thank you.
Fine. Thank you.
Is it okay to have another question?
Yeah, sure.
So most of these therapies have something that we can use on ourselves without going to a therapist or a psychologist. Is that true? Like, can we just go and use one of these?
What's the question, ma'am? I'm not that too clear. Without meeting therapist and psychologist, what she said, what she asked?
Without going to a therapist, can we use these methods alone, like without?
No, only therapist alone can render. Therapist is a specialized person who is very master, and cup of tea. Many therapists are there. CBT will be the cup of tea of that particular therapist. He'll be very master in CBT. He would have given thousands of CBT to clients. So that cup of tea could be CBT. So we recommend only therapist. So you should be therapist, the right way.
Okay.
And
So
let
I
me
would like
re-mention.
to
Yeah.
highlight a point here. Even
Yeah,
in few countries, they go for surgery for mental illness. I'll tell you when they'll go for surgery. Not psychosurgery. Psychosurgeries have been banned some long back, like subchoroid limbic leucotomy, tractotomy, basal ganglia they'll remove, or some part of the brain they'll remove. And after many surgeries, they found it's of mere waste. And they've dropped all those nonsense procedure. At present, they follow bariatric surgery for EPS, extrapyramidal side effects. If a patient is receiving antipsychotic for a long time, he may develop EPS, extrapyramidal side effects. So in such case, we just shift the patient for bariatric surgery, in the sense, we just cut the portion of stomach and we make anastomosis or connect it to the small intestine, so that the absorption rate, when the patient takes, after bariatric surgery, if a patient is taking antipsychotic, the absorption, because the portion of stomach has been cut already, and only the absorption rate will be very less, automatically EPS symptoms will not develop much. That's why we practice bariatric surgery. Next. Any more queries can be asked right now.
Any more questions from Dr. Sampoornam? As she is having a network problem, I can get your answers through email also. If you are having any queries, any questions? Yeah. Hello.
Just for the mental checkup she talked about at the beginning. Where do we get this mental checkup? Do we just go to a therapist and ask them for it, or?
Yes, that she said the same.
Yeah.
Yeah.
Do we just tell them to check up our brain or something? How do we do it?
The therapist suggest, I guess, as far as I heard, Dr. Sampoornam said that we go to the specialists and then they suggest the checkups, the particular ones.
Oh,
And
okay.
even if you are having more questions or want a detailed information or detailed answer on the same, you can just write down the question to us and we will definitely get the answer to you at your mailbox as soon as possible.
Okay, thank you.
And we are sorry that Dr. Sampoornam was having some network issues today.
It's okay.
Yeah. And definitely